Hi, awesome human anatomy and physiology students. I'm going to use these slides to summarize high altitude pulmonary edema, which we learned in class today. We summarize as HAPE and a couple other things associated with it. And this all relates to fluid building up in the lungs. So that's kind of the general take-home message and the symptom or cause of high altitude pulmonary edema. And a lot of edemas is just liquid escaping from our blood vessels. So this all comes back to acute mountain sickness, AMS, which some of you read about or taught your classmates about. Happens usually above 8,000 feet, so you can tell that in terms of human body evolution, our ancestors in the past tended to stay away from those types of elevations. It's sort of like scuba diving in that the faster you climb to a high altitude, the more likely you are to develop acute mountain sickness. Your body just doesn't have time to produce the red blood cells and acclimate to the environment and the rapidly thinning atmosphere. The reading noted that the symptoms often resemble drunkenness, nausea, vomiting, headache, fatigue, and so on. There are a number of mechanisms postulated in terms of what is causing this, but it's just a collection of things, right? Cerebral edema, that's fluid buildup in the brain. Alcoholysis just means that your CO2 levels are dropping, which I know is counterintuitive, but if you're getting less oxygen, you're also producing less CO2. It's just another indicator that you're suffocating. Hypoxemia, as we know, is just a lack of oxygen in the blood and a lack of oxygen to the tissues. Your body responds to that in a number of different ways, but mostly just by dilating arteries, increasing your blood pressure, things we learned about before, which just worsens things even more, and fluid then begins to leak out of vessels. And again, this usually isn't that bad if you can get back down to regular or elevations below 8,000 feet and recover. There's no permanent damage, but if it continues, it can become much more severe and result in HAPE or HACE. So HAPE is high altitude pulmonary edema, which we've been learning about. HACE we'll get to a little bit later, but that's high altitude cerebral edema, which is happening in the brain. Okay, so acclimatization is the key thing, but if your body isn't acclimatizing, then there's a bunch of different bad things that happen. Alveolar hypoxia, again, just means that your alveoli, right, those tiny little sacs which are in our lungs and surrounded by capillaries, aren't getting enough oxygen out of them. The pulmonary vasoconstriction, meaning that there's just less blood coming from the being delivered to the lungs, which is going to increase arterial pressure. Your heart's going to be working harder to push the blood to the lungs, which leads to hypertrophy. That is the enlargement of the heart. Heart enlarges because it's trying to pump more and more blood towards the lungs. Increased pulmonary arterial pressure, again, it's just having a hard time, and therefore that's when you get the edema. Liquid starts to leak out, and then you get fluid buildup inside the lungs, inside the brain. You have damaged capillaries, all kinds of bad stuff happening. So HAPE has a couple different forms, but they think of it as a non-cardiogenic pulmonary edema, which just means that it does not have anything to do with the heart technically increasing its blood pressure. Sometimes this can just happen because your capillaries are getting leaky by constricting, and therefore just that constriction alone is increasing the blood pressure. Symptoms, again, first 2 to 4 days. It's kind of unfortunate because the early symptoms include just things like shortness of breath with exercise, decreased exercise performance, which all climbers are facing regardless of how prepared they are for altitude. So a lot of people probably don't notice that they're actually developing something much more severe than just being overly tired at high elevation. But that's the kind of giveaway that if it progresses, where even at rest you're having trouble breathing, that's kind of a key giveaway. Persistent cough, that's kind of the bad news, that if it's not related to air you're breathing into the atmosphere, then that's when you need to get checked out. And if it's untreated, it can lead to coma and death because, again, you're not getting enough oxygen to your different tissues, your brain is swelling with fluid, and so on. So the Lake Louise consensus definition, this is sort of just what puts all the stuff together for HAPE. So the classic symptoms, if you display any two of these things, then you definitely need to be checked out and stop your climb in elevation. But the key signs are at least having two of these, right? The crackles or wheezing in the lungs. So it's always good to have a stethoscope or have someone who can listen to your breathing. That crackling is definitely an indication of fluid buildup inside the lungs. That's not a good thing. The central cyanosis, that's the blue skin. Again, that's just an indicator of a lack of oxygen. Having an oximeter too, just to measure your SpO2. If it's going down pretty rapidly, then you're definitely having hypoxemia. Tachypnea is just rapid, shallow breathing. So like almost panicky breathing. Your body's just trying to get as much oxygen as it can, almost like panting. And tachycardia is rapid, increased heart rate. And again, something like an oximeter could help you monitor that. And again, these will worsen overnight too. So even if you're trying to rest, you continue to have this very rapid, shallow breathing and very rapid heart rate. Those are bad signs. So as I was drawing earlier, normally you have blood being pumped through the pulmonary artery to different parts of the lungs, specifically the alveoli. The capillaries pass through, that's where the gas exchange occurs, and then it's pumped back to the heart and then onto the body through the pulmonary vein. However, in the case of high altitude pulmonary edema, the lack of oxygen causes these capillaries to constrict, which means they get smaller. Pressure increases, the heart starts working harder to pump blood to the lungs, and fluid begins to escape. Basically, your capillaries get a little leaky, so there you can see the fluid building up inside the alveoli. That means there's less gas exchange occurring in each of the alveoli, and that collectively is not good, right? That's drastically going to decrease the O2 content of the blood and the amount of oxygen being delivered to different tissues and organs in your brain. And again, this liquid is also gives that kind of crackling, wheezing sound that you can hear when people are experiencing HAPE. So again, there's a number of different mechanisms behind what's causing this. We've highlighted a few, but a couple of vocab words here. So it's increased pulmonary arterial and capillary pressures. Again, it's that hypertension of the blood's just heart's forcing blood towards the lungs and working harder to do that. And again, you have this vasoconstriction where again the capillaries inside the lungs are shrinking, and that's again increasing pressure and making them leaky. Idiopathic just refers to sudden, not related to anything else. It just happens randomly. Non-inflammatory increase in permeability of vascular endothelium, which is a very complicated way of just saying that this is a sudden non-inflammatory means it's not an immune response. It's not like you cut or injured your lungs in some way, but an increase in permeability of the vascular endothelium, which basically just means that, again, in that alveolar sac, there's sort of a wall, very thin one, between the blood vessels and the air, right? This is where the blood would be on the outside passing by, and the air is on the inside, and it's what they refer to, the vascular endothelium, means that this is swelling and getting bigger, meaning there's more of a barrier, and it's full of fluid now between the blood and the air that it needs to be exchanging oxygen and carbon dioxide with. Again, not a good situation, and it's going to lower the amount of oxygen your blood can get. So treatment, obviously, administering oxygen in a more pure form is going to help the few functioning alveoli that you have deliver more oxygen to the blood. But obviously getting down to lower altitude is going to be the key thing. Just getting to air that it has more oxygen in it, taking rest, but again, not resting at very high elevations because again, you're going to have that tachycardia and tachypnea, the shallow breathing and heart rate still. There's a number of different treatments. Dexamethasone is just anti-inflammatory. It reduces things, inflammation. CCBs are calcium, what's the term? It's a calcium channel blockers, which is sort of just decreasing blood pressure is the main thing that those do. Phosphodiesterase is another medication used to decrease blood pressure. And this is kind of a funny one because this is what's used for treating erectile dysfunction. So this was that drug that they released it and tested it on people and discovered that it worked, but it had an interesting side effect. And so now it's also used for treating erectile dysfunction. But it's the main thing is that it reduces blood pressure. And so all of these kind of calms down your heart, calms down your circulatory system, makes your blood vessels less leaky, right? That's the key thing, is just we want to make everything less leaky, less inflamed, and therefore the lungs can be clear of fluid and go back to functioning normally. Okay, hope that helped. Thanks a lot.